Let's start from the beginning. Catherine and Kendall are discussing about the pharmacology test they just failed.
How do you feel about that test, girl? I'd rather not talk about it. I think I heard a sexting.
Suddenly, Catherine had a tight feeling in her chest, and she was having trouble breathing.
Okay, I'm gonna call 911.
She is diagnosed with asthma and is in need of some albuterol. What is albuterol? Nurse Carly and her nursing student Sarah are here to clear up that information.
Good morning. My name is Carly. I'm going to be your nurse for today, trying to help you out with your situation.
And I'm Sarah. I'm a nursing student, and I'm going to be working alongside Carly today.
So can you tell me a little bit about what happened?
Well, I was walking up the stairs today.
It's okay, I'll tell them. Basically, we were coming back from class, and we were talking and walking up the staircases, and all of a sudden she just seemed like she was dying. She started coughing and couldn't breathe, so I called 911, and then I called her mom, and her mom's on her way in a little bit.
Okay, so I hope that your first treatment has been successful. You looked a little bit more relaxed than what you did when you first came in. We've done a few tests. What we're leaning towards as of right now is what you experienced was actually an asthma attack. And so what we're going to do for that is we're going to actually give you an inhaler that has albuterol in it. Do you have any questions?
What is albuterol?
Well, albuterol is a drug that we use to treat...
Oh, it's your mom. Hang on, I'll be right back and get her. Yeah,
Nurse, I heard my baby had an asthma attack.
It's okay. We're actually about to educate a little bit about the drug that we're actually prescribing her. So we gave her some albuterol and an inhaler. So what's going to happen when she inhales it, it's going to be absorbed by her body. About 20% will be absorbed by her bronchi epithelial cells in her lungs. For distribution, the volume of distribution is about 3.4 liters per kilogram and about 10% to your plasma proteins. Metabolism is going to be metabolized by your GI tract, and it actually turns into albuterol 4-O sulfate. Excretion, about 80 to 100% of it will be excreted in your urine, about 0 to 20% in your feces.
Okay, so when you take the medicine, it's going to kick in about 5 to 15 minutes. It's going to work the best around 30 to 120 minutes after you take it, and it lasts for about 3 to 4 hours.
So we talked a little bit about absorption. These drugs that are listed here can actually alter the way it's absorbed and it make it a little bit not ineffective. So if you're taking digoxin, diuretics, antidepressants, beta blockers, anything like that, it could affect the effectiveness of your drug.
So the pathway in your body, it travels through your airway into your lungs until it reaches the bronchial epithelial cells, and it uses the CAMP pathway.
So interaction with receptors, it actually binds to your beta-2 adrenergic receptors, and it deals with that CAMP pathway that she talked about. It's going to increase activity of protein kinase A, inhibits phosphorylation of myosin, and lowers intracellular calcium concentrations.
For the toxicity, there's not really many defects found from too much albuterol, so you don't really have to worry about that too much, although it can cause cleft palates and limb defects if you're pregnant when you take it. If you do have a toxicity, you're going to have some tachycardia, hyperglycemia, hypotension, pulmonary edema, ACHF, and death. The pharmacokinetics of this are not fully understood.
Contraindications of albuterol. It can be contraindicated with patients that have a history of hypersensitivity. So if you're allergic to any drugs, especially the albuterol and its family that it falls into, you could have some problems.
There hasn't really been found to be a racial difference in albuterol absorption, except for men absorb it faster due to their lean body mass. In a study, the effect of albuterol from person to person, depending on which haplotypes the person had, people with 2-to-2 combination had about 50% greater response to the drug than people with 4-out-of-4 combinations.
Age and albuterol, elderly, there's not really much studies on it. For children, you have reduced bioavailability, but seeing you're a college student, you should be fine about that.
For metabolism, literature suggests that the primary enzyme responsible for the metabolism in albuterol is sulfotransferase, and that is it.
Do y'all have any questions?
No, thank y'all so much for taking care of her.
Y'all have a nice day.
You
Thank
too.
you.
Come on, sweetie.